Morning again, everybody. We are with the evaluation office today. As you all know by now, they have issued a very interesting series of reflections called Reflections. And today we're talking about their edition on social protection. Now that is a hot potato because without them knowing it at the time, because I'm sure the plans to come up with this reflection were formed 3, 4, 5 months ago. Social protection and anything that has to do with it is now has been elevated to one of the 4 pillars of the UNDP offer 2.0 on COVID, right? So what a coincidence. This was foresight by Oscar and his team. So we're looking at country stories here, but country stories from evaluations, right? So we're looking at a 10-year time span. They digged the whole database of the evaluation office to see what evaluators have brought up in the past, to condense that nicely. And I looked at the PowerPoint. It is so simple because in the end they're coming with 6 tips, 6 pieces of evidence. How more pointy can it be? So let me not take too much time before I move to the microphone to them. Just to remind you, this webinar, of course, will be recorded. It goes straight into Teams. The questions and answers can be answered already while we are talking, so you can be active on the chat. But if there are questions that can also not be asked at the end of the session because we're running out of time, it will still be answered in writing on the team site somewhere in the course of the day. Over to Oscar.
Thank you very much, Jan Thomas. Good morning, everybody. We're delighted to have you in this webinar. COVID-19 forced the Evaluation Office to rethink our program of work. We wanted to come up with evaluative evidence that would be useful to support our country offices and resident representatives to deal with the preparedness, response, and recovery from the crisis. Therefore, we have gathered information of UNDP response to previous crises, such as the Indian Ocean tsunami in 2004, the HIV/AIDS, Ebola, SARS, avian flu, to name a few, in addition to our work in earthquakes and hurricanes. It is based on that experience that we have prepared what we call rapid evidence reviews. Rapid evidence assessments are simplified versions of systematic reviews. They look at evaluative evidence produced by IEO and also by UNDP decentralized evaluations from 2002 onwards, with a stronger focus on the last 10 years. We have an evaluation resource center, which is a repository of more than 5,000 evaluation reports. And we have undertaken a very rigorous screening process, and each paper reviewed systematically and large number of evaluation reports from which we have extracted lessons. Today, we are delighted to have you with us on the paper on social protection. With that, I think the presentation should be up, and I would like to introduce my colleague, Vadivelu, who led this exercise together with other colleagues in the office. Over.
Please take it away.
Yep.
There we are.
All right.
We're not hearing you though.
Vijay, you're muted.
Still muted.
Just go. Oh, I think I'm all set now. Thank you, Jan Thomas. Thank you, Oscar.
Put your PowerPoint in presentation modus so we can even see it even better, and then you are on your way. There we go.
Thank you, Jan Thomas. Thank you, Oscar. Thank you, colleagues, for this opportunity to share lessons from the evaluations of social protection programs. And special thanks to those colleagues who bravely came to this on a Friday evening. Appreciate that. As you know, UNDP's comparative advantage is its ability to address social protection at a cross-sectoral level compared to the sectoral focus of other UN agencies. This also meant that social protection programs are often dispersed under different areas of work of UNDP and hence not specifically addressed by many evaluations. So for drawing for this reflection paper, we particularly looked for support to social protection policies, social safety net programs and tools, and innovative approaches. A quick word on the method used. The reflection paper draws from an analysis of 30 ICPs, independent country program evaluations, and 8 thematic evaluations and their country case studies carried out by the independent evaluation office, and 9 decentralized evaluations carried out by the country offices. In the reflection papers, we present 6 lessons, as Ian Thomas just mentioned. I'm pleased to share with you 4 of them here today. Lesson 1. Although it seems a no-brainer, a lesson worth reminding ourselves while in the midst of the COVID-19 response is that strengthening social protection policies contributes to effective crisis response. It cannot be more emphasized than that. Countries with social protection policies enable the governments in developing well-targeted, context-specific measures during crisis. Also, embedding social protection measures in poverty alleviation and disaster risk reduction strategies enable long-term resilience and adaptive capacity. For example, in Gambia, Tanzania, Belize, social protection policies promoted improved social safety nets. In Egypt, social policy and institutional measures to strengthen national cash transfer programs enable better reach of vulnerable communities. In Mauritius, strongly embedded social protection policies facilitated budget allocation and minimized ad hoc responses during crisis. We will hear more about Mauritius' example in a little while from Renooka. Lesson 2. Targeting vulnerable sectors, particularly those that generate employment, yields positive dividends for social protection efforts. So economic packages and social protection measures targeted at vulnerable sectors protected jobs during crisis. Although a little far away example, as Oscar just mentioned, but which has still relevance to the present day crisis, is the measures taken during tsunami response. The Indian Ocean tsunami severely affected tourism in Thailand, Sri Lanka, and Indonesia, with significant consequences for jobs and livelihoods in the aftermath. There was sectoral support with targeted measures to revive the tourism sector, to save jobs and protect livelihoods, an example worth revisiting. Informal workers and wage laborers are more vulnerable to economic shocks and crises. Hence, targeting such groups must be prioritized. National employment generation programs, as seen in Pakistan and India, are important mechanisms for targeting social assistance and guaranteeing minimum work during crisis. Lesson 3. The institutionalization of social safety nets, measures, and processes is fundamental to their success. Country examples show that infusing cash reduces harmful coping strategies during crisis and hence is one of the popular social safety nets measure. Examples from Haiti, Burundi, Yemen, Indonesia show that design of the cash intervention should take into consideration institutional capacities in the country. Strategies that simultaneously addressed strengthening local capacities enabled more efficient cash transfer. As Haiti example shows, too many procedures, even if it's for accountability, can slow implementation and drive up cost of delivery. So there is need for balance. In Ecuador and Indonesia, the institutionalization of cash for work and cash transfer, particularly linkages with social and economic policies, reduce the extent of human loss and suffering during crisis. Also, timing of the social protection measures, that is faster responses, for example in Syria and Haiti, is critical for reducing negative coping mechanisms. Lesson 4. Using technology in the provision of social protection assistance improves efficiency and targeting. Technology, whether it is electronic cash transfer systems, biometrics, or block technology, improved the quality and cost efficiency of social assistance, increased transparency, and targeting. In response to the Ebola crisis, UNDP implemented recovery cash transfers for affected survivors in Sierra Leone. These were administered using existing electronic cash systems of a national telephone provider to achieve a secure and efficient delivery of assistance and at the same time strengthen financial inclusion. Similarly, the use of biometrics and blockchain technology in Jordan has improved the quality and cost efficiency of social assistance while reducing opportunities for fraud, duplication of services, and mistargeting. Lastly, Unified Beneficiary Registry in Malawi, which serves as a national social registry, is an example where the national identification system was used to improve targeting and as an effective information system for social protection. I will stop here and hand it over to our colleague from Mauritius office, Renooka Beejan, who will share more about Marshall Plan and how it is used in COVID response. Thank you all once again, and over to you, Renooka.
Thank you, Vijaya. Good afternoon, colleagues. As you may be aware that Mauritius has performed well in various global indices and is seen as a model to replicate in the African region. However, according to the Poverty Analysis 2012, there's around 10% of the population that live in relative poverty. Therefore, UNDP was requested to provide technical assistance to elaborate a Marshall Plan to fight against poverty. The Marshall Plan proposes a social inclusion framework anchored in human rights to assist with the integration of the vulnerable segment of the population into the social, political, and economic life of the nation. It is comprised of around 39 actionable and costed proposals and cover the following areas: social protection, employment, social housing, education, health, environment, equity in service delivery. The key recommendation of the Marshall Plan is to establish a Marshall Plan social contract. It is operational since January 2017, following the enactment of the Social Integration Economic Empowerment Act 2016. It is a conditional cash transfer type of contract with provision of cash allowance to households found eligible under the Social Register of Mauritius, conditional to education of children, economic empowerment of adults, family empowerment, and health. For instance, children 3 to 23 years should attend 90% of schooling and adult training to enhance employability skills. Next slide, please. UNDP supported to develop the Social Register of Mauritius, which is a computer-based application to register and identify the poor and their socio-economic profile. In fact, it aims at improving the targeting efficiency of social programs so that limited resources primarily reach the most needy. Mauritius has adopted the proxy mean test to identify the eligible applicant who register in the SRM. The PMT method provides a formula for predicting the living standard of each household which registers in the SRM. The formula is based on demographic and socioeconomic characteristics such as age, gender of head, number of kids, adults, and elderly in the household, as well as housing conditions such as construction materials, availability of water, toilet facilities, and asset ownership. Next slide, please. The SRM has been instrumental to the government to reach the beneficiaries during the COVID-19 crisis. A letter of agreement was signed on 6 April 2020 between Ministry of Finance and UNDP for support to the government to address the COVID crisis for a total package worth $800,000. The government of Mauritius then set up the COVID Solidarity Fund under the aegis of the Ministry of Finance, out of which $325,000 was transferred to COVID Solidarity Fund to cater for the supply of basic necessities to 35,000 vulnerable households, more specifically to those registered on the SRM, and to shelters for children and women in distress during the COVID-19 pandemic outbreak period. UNDP Mauritius was part of the process of contributing to social protection through the COVID Solidarity Fund to support the vulnerable people during this difficult time. This is the end of my presentation. Thank you. Over to you, Vijaya.
Thank you very much, Renooka, Beejan, for sharing Mauritius experience. Over to you, Jan Thomas.
Thank you so much. I mean, one thing to note, on Mauritius, I think the system was set up way before COVID, right? I mean, it's not a social protection system. You don't set it up when COVID hits, right? Usually it's not a good time. So this looks like a very visionary and prospective look on things. And by the time COVID hits, you can actually find the most vulnerable, and you can make sure that the resources end up in the right place. Very good example. On the let me put gallery view. I don't like to look at myself too much here. Okay, this is much better. On the reflection itself, I mean, I think I find a very, very interesting parallel here. I mean, while the Independent Evaluation Office already saw early on that social protection would be a hot topic in UNDP, I see two themes here. You notice informality as well as digital. These two things have now surfaced also in our offer, particularly. I mean, Mansour and his team have just recruited a number of people that are particularly focusing on these two aspects of social protection. So I think somewhere in this organization we still have a brain collectively, not as individuals only, but there is a thread here, and that is very reassuring, I have to say. Very, very good. Thanks so much. This was extremely interesting. We have questions. I saw Ruben.
Yes, good morning. Thank you, Jan Thomas. I wonder, in lesson 3, you mentioned the importance of linkage between cash for work and social and economic policy. But in the experience, in the lessons learned, as colleagues come across the relevance of fiscal policy specifically, and in that respect, the fiscal space in ensuring that cash for work and cash transfer is continued during a time of crisis. Thank you.
Vijay, we'll do the questions one by one. It creates more continuity. You want to tackle that one?
Can we take a couple of questions, or it's
I get very confused when we do a couple of questions.
Okay.
I can't track it. Please,
Okay.
please.
Thank you for that question. I think the relevance of the fiscal policy cannot be emphasized more, particularly in cash transfers. One of the key constraints in cash transfers is also how much funds are available, particularly in terms of the allocations and how that is efficiently executed. So these two are linked, and whether those mechanisms are in place prior to the crisis becomes very fundamental, like we have seen in the case of the Marshall's Plan, or in other countries where social protection policy is already in place, because certain budget allocations are already made for certain cash transfers to be made. If it's introduced during the time of the crisis, it will be a lot of chaos, as we are seeing at the moment that's going on in countries which did not have social protection policies, and there are no mechanisms to allocate resources as well as to deliver those ones. So these are very related ones, I think, overall. Yeah, thank you.
Next question is for Pepe.
Hi, Jan Thomas.
Hey.
Yeah. Hello. Yeah, my question is about the sustainability of our social protection support when we are targeting informal sector. I usually hear that one of our flagship support is cash transfer. But cash transfer to me is not sustainable to my view. So I just want to understand better how we can do this and how we can ensure sustainability in informal sector. Thank you.
Cash transfers and sustainability in our minds don't always go together, right? How do you look at that, Beejan?
No, definitely cash transfers have several limitations, but they have their own value as well. Immediately after the crisis, when things are not even, when there's no work even, for example, during COVID, COVID itself is an example where even to provide temporary work, the work is not going on. But people who are in informal sector, laborers need money. So cash transfer becomes an invaluable tool for a short period. It's not for a longer period. It's for a short period until the economic activity starts. You can take any big disasters or crises. There is a period when nothing goes on, and during that period, certain sections of the vulnerable population need to be infused with cash. For their sustenance and also for the economy to kickstart and keep going. So there is a value for that tool, and it's a most popular tool because it also has political dividends, so it's a very popular tool. It's not meant to be a longer term one, it's meant to be a very short term one immediately after the crisis, and then when other economic activity starts, other measures need to come. So I agree with you, it's not sustainable. Yeah.
It's not sustainable, it has its use.
But
in a good system, of course, you have different avenues, some that speak to an immediate situation and some that speak to a later on situation. And that's when you have a system, right? Not just a panicky one-off COVID type of thing. A system can cater for different windows.
Just to add, because if the things settle down, you have cash for work. And even for that, you need to have mechanisms like some of the examples from the UNDP program show that if you already have certain national programs and well-established ones, it becomes a very good delivery mechanisms to even execute cash for work. So cash transfer, cash for work, these are all sequence in which it takes place.
Sophie in Indonesia, we want to reward you for the fact that you're staying up at night on a Friday evening, but you can only ask one of your 25 questions, please. One.
No, I have two questions actually, but before that I want to say a very big thank you for mentioning Indonesia on a number of occasions, actually as good experiences. Thank you for that. Well, I will still ask my two questions and then you decide which one you want to answer, but I was wondering if there were any good experiences on leveraging social protection mechanisms, whatever it was, for promoting gender equality. And when asking this question, you know, I want to go beyond just mechanical sex disaggregation data, but looking deeper, you know, on how social assistance can leverage different power dynamics on the ground. And the second question is related about linking social protection and preparedness of the communities, particularly in disaster-prone areas, and in enhancing coping capacities of the communities in the areas where they are particularly prone due to the disasters. These are my two questions. Thank you.
Thank you very much, Sophie, for those good questions. Actually, if you look at our reflections paper, we have one of the lessons on gender particularly. It's a lesson where we have an example of Dominican Republic, but the big lesson from there is we are not paying enough attention to gender dimension in social protection. We all know crises disproportionately impact women. And even during normal times, social protection measures are not gender sensitive. They're not women sensitive. That comes in a big way when you look at the evaluations. There's not any specific activity UNDP has supported on this topic, I would say. And also stereotyping of social protection measures is what we see usually in UNDP work, as well as in work of the other agencies. Very typical ones, assuming that women don't do some things or only do certain things, whether it's cash for work or other activities, or even health. If you go to the providing health facilities. So these are some things which is not addressed by UNDP. I think it's a big lesson for us to pay attention during this pandemic when social protection measures are being designed. Attention is needed. We don't have any good examples from our evaluation.
I mean, Renooka, in Mauritius, you have a specific attention, making sure that women, men, elderly, and I think you mentioned the elderly. Women, men, and elderly are equally, served by your social protection system.
Yes, they are inclusive in the social protection.
How did you do that? What kind of measures have you put in place?
Like in the system, you register the applicants by gender and also by age, and then you have also different aids related, like for the type of social program they are eligible to.
Okay, so there is a good attempt there to make sure that these systems are, although maybe globally that's not a strong point, if I understand it well. The second part of the question was about the link with disaster risk. Is there anything explicit there, Vijay, that we could learn from?
Yeah, actually, just Renooka was sharing with me that there is special attention paid to including women as beneficiaries, particularly women-headed household, as part of the Marshall's Plan the other day when we were discussing about it. I think including the linkages between social protection and disaster, this was also contemplated in Indonesia. The examples from UNDP shows that the success is much more when the disaster policies integrate social protection within the disaster policies. And Indonesia and a few other countries were contemplating this as a good example. So it's a good practice to move forward both poverty alleviation policy as well as the gender policy, as well as the disaster management policy. But one of the issues related to most of these lessons is also how one engages private sector, because there are some questions on informal sector, how to address that. That's another area where UNDP is well positioned to address how private sector can be engaged in social protection, because given the finite resources, government cannot by itself have an elaborate social protection system. So engagement of the private sector will be very critical. The tools UNDP can provide to the countries will be very critical in this regard. That's what the evaluations show.
Thank you so much. Ladies and gentlemen, there is quite a few remarks and also hyperlinks being shared in the chat. So please go there. The half an hour, it flies by when you're having fun, of course. But we have one more question. I need to be selective here. So many people that want to engage. But Sarah Bell, can I invite you to your question? Please unmute, please.
Sorry, typical issue with mute and mute. I think there were a couple of questions about universal basic incomes and how that relates, or how that can complement, or how we can move from one system to the other. My question generally is about the pros and cons of a typical mechanism we have discussed here, so conditional cash transfer, cash for work, cash transfers, versus a universal or temporary basic incomes. So pros and cons, and how easy it is to move from one to the other. So for instance, do we have good example of countries that had a solid set of mechanism in terms of cash transfers that, based on that, moved easily during COVID to extending the mechanism into universal basic incomes to make sure that the entire informal sector is covered, and especially women, as Sophie mentioned?
Well, that's a big question, and I'm sure we can touch on it, but this would require a whole seminar, right? Right here and there, or a discussion on the team space. Who wants to? Who has a good perspective on that? Universal basic income, cash transfer type of things, and how one can morph into the other potentially. Oscar?
Yes, allow me to try to respond to that. Very good question. We have seen that the experiences that work well are the ones that are building on existing mechanisms of social protection during times of crisis. And therefore, we have seen that an expansion of that in order to try to link the informal sector that usually is not reached out during this normal times to universal basic income schemes is really the response that has happened, but not so often. One of the challenges there is the sustainability of those efforts. And that's why the question about the fiscal space is so important, because otherwise you won't be able to sustain those schema and the inclusiveness that is embedded within them. So what is then our contribution to rethink the offer UNDP 2.0 is really how to make this effort sustainable. I think there are a number of questions and we would be happy to address them. And related to the employment linkage, we will have another series of webinars on protecting livelihoods and creating jobs. Over to you, Jan Thomas. Thank you.
So that's an interesting discussion that we should not go out of the way, I think, because the sophistication of systems to take care of poor people, of course, with sophistication comes sustainability. At the same time, with sophistication, sustainability doesn't come speed, right? Unless you have these things ready, you will not do anything when a COVID crisis hits. And sometimes immediate action in a post-humanitarian or in an almost humanitarian setting is required. So all these tools are important, but extremely important to see which one to pick when and how some of them can give rise to others. I think it's extremely, and I'm sure, I mean, the way we go now in Offer 2.0, these kind of questions will be, we will be on the forefront in months and years to come, I think. Thanks so much to our resource persons. The Mauritius example turned out to be very illustrative, Renooka. Also in terms of your gender angle, I'm sure other people will want to take advantage of that. Ladies and gentlemen, we can't go deep in half an hour, and that's not the point, right? The point is to meet here, to engage on some of the concepts, and then to find each other a little later. I mean, you have Vijay there, we have Oscar there, we have Renooka there. I mean, they will point you to others again. So please don't be hesitant to contact any one of them, because there is a lot to learn within UNDP. Huh? You don't have to go anywhere except within our organization. Find a colleague that can bring you a little step further.